Hi friends, hi family. Bear with me a little. I had already settled in my bed and was just reading through comments on my leptospirosis video. And people, take time with me. Take time with me. Somebody asked me what is fecal matter and tell me that I need to use words that people understand. Take time with me, people. Take time with me. I've been an educator for many years at the tertiary level. I'm doing my very best to break down information in language that the layman can understand. But as an educator for over 20 years and a doctorate in epidemiology, sometimes the high-level language is going to slip out. So bear with me. The person said I should say what fecal matter is, and I should share how you know how you have leptospirosis. So I'm going to do just that in this video. Hang tight, stay with me, like, share, comment, follow for more information like this. So fecal matter, fecal is the description of feces, and feces is number 2, doo-doo. For those who are confused, that is what we mean by fecal matter. Okay, that's not related to the leptospirosis because my video, even though I talked about leptospirosis in it, I was talking about the dangers of floodwaters. But leptospirosis is not passed on from human to human. So it's not human to human transmission like the flu. It is a zoonotic disease, which means that it is passed on from animals to humans. It is the urine of mostly rats. Other animals can carry the leptospirosis bacterium, but it's mostly transmitted through rats. So goats, pigs, cows, sheep can carry the leptospirosis bacterium, and they do so in the urine. So that is where I was talking about the floodwaters being contaminated with animal waste. Okay? So the urine of these animals carry leptospirosis. You get exposed to leptospirosis through exposure to the urine of these animals, whether in soil or mostly leptospirosis is commonly caused by rats because rats are in your house. They come out at night. They pee on food if it's opened or exposed to them, or cans. So you need to wash your cans, your tin food, when you're going to use it. And now people are sending and donating a lot of items that are in cans. So wash your can before you use them because the rats will pee on them. But the leptospirosis now, after the hurricane, I do think that you're getting exposed to more than the urine of rats because other animals have been displaced from their natural habitats and people are outside, and so you have to be extra careful. How do you know that you have leptospirosis? Leptospirosis can cause a range of symptoms like mild flu-like symptoms such as headache, dizziness, fever. In this case, the fever is very high, at least 104 degrees Fahrenheit or up to 40 degrees Celsius. Now, your normal body temperature is somewhere around 36.5 degrees Celsius. So when you have a temperature of 40, it means that you're roasting and your chemical reactions can't do well under such high temperatures. So that's why you're getting sick, and under high temperatures, your blood lyses. What do I mean by lysing? Your blood cells begin to break down, and that's why you get jaundice, because it releases hemoglobin from your red blood cells. It breaks down into bilirubin, which is the substance that causes jaundice. So you will see your eyes looking yellow. So if you have flu-like symptoms, fever, headache, chills, and then you begin to have diarrhea, vomiting, and then you see your eyes start looking yellow, then those are some of the signs that you might be having leptospirosis, right? So I talked about why you might have jaundice, which is what we call when you have the yellowing of the eyes. But technically what's happening is that your red blood cells are lysing because your temperature is too high. Your red blood cells are lysing and it releases hemoglobin. Hemoglobin breaks down into bilirubin, and it is the bilirubin is the yellow pigmentation that will cause jaundice. Jaundice also results from a similar mechanism in the body that's taking place, where if your liver is damaged, then there is an extra production of that bilirubin as well. And these things are dangerous because a buildup of bilirubin in your blood is also dangerous. When do you start to have symptoms? Symptoms of leptospirosis can appear 2 to 30 days after exposure to the bacterium. I'm not even, because I'm so worried about people telling me that I need to use words that they can understand, I'm not even going to call the bacterium that causes leptospirosis for us. But you can develop symptoms as soon as 2 or as late as 30 days after the exposure to the bacterium. So like I said, symptoms include regular flu-like symptoms like high fever, chills, headaches, muscle aches. The ones that we watch for now are the nausea and vomiting, the diarrhea, your red eyes or your yellow eyes. Sometimes you can have discomfort in your abdominal area, so in your stomach area. You might have discomfort or abdominal pain. More severe symptoms would include jaundice. So like I said, yellowing of skin and eyes due to liver involvement, or like I said, a fever can cause lysis of your red blood cells and so on. Kidney damage. So if your kidney is damaged, you will have decreased urine output, so you're not urinating as much. And also you'll see blood in your urine. Again, the breakdown of the red blood cells. You can end up with respiratory issues such as coughing up blood and chest pain. And also there can be meningitis, which is inflammation of the membranes that are surrounding the brain and your spinal cord, leading to severe headaches and neck stiffness. There can also be internal bleeding. And how do you know you're having internal bleeding? You can have black, tarry stool, just like tar. Tarry, so it's black and it's viscous, meaning that it's a little bit thick, and you might have rashes or red spots on the skin. Now those are the more severe of the symptoms. If you begin to have flu-like symptoms, then you need to pay close attention, watch what those symptoms are, track your symptoms, and make sure that if at all possible, you are seeing a doctor to get tested, right? So because the symptoms begin mild, like flu-like symptoms, don't ignore any flu-like symptoms that you're having at a time like this, especially if you're in an area where there is an outbreak. But I hope this is good news. You don't get leptospirosis from human to human transmission. You have to come in contact with the waste, urine of animals. So if 2 members of the family end up with leptospirosis, it's because both members have been exposed to the carrier of the infection, which is usually the urine of rodents. But because there's so much damage, there is a risk that you are exposed to contaminants from other animals that have been displaced during the storm, and the urine that then gets mixed with the floodwaters, which is why my video focused mostly on floodwaters. At the time I did my video, there wasn't yet an outbreak declared, so I didn't spend much time talking about the symptoms and so on of leptospirosis because I was talking about prevention. Now, I'm an epidemiologist, so I focus on public health concerns, the distribution, the geographical location, time, place, person of disease, more than I do symptoms and treatment. All right. So again, I'm going to say, take time with me. I'm trying my best, folks, to break the information down into layman's terms for you to understand. The educator in me comes out all the time, the tertiary educator. So bear with me. Continue to like, share, follow, and comment. When you do that, then the video gets shared across the board and more people have access to this information. Thank you so much. Like I said, I was already settled into bed. I had to throw on some clothes because I think it's important for me to respond to these comments. As much as I find the comment a little rough, take time with me. I can't manage the roughness. I'm just here to bring your information. I want to hear your comments though. I want to hear what you're saying. I want to know what you want to know so that I can share that as best as possible in layman's language. So thank you, my friend, for asking what is fecal matter. Thank you, everybody, for your kind comments, your questions, your concerns. Let's take care of each other because we are our brother's keepers. Remember now, a merry heart doeth good like a medicine, and a broken spirit dries the bone. I am Dr. Tamara, your online epidemiologist. Take care now.